Pediatric Cardiology is a well-upcoming branch which has improved significantly over a decade and being able to diagnose and treat congenital and acquired heart disease in a more systematic and comprehensive method, which were neglected or underdiagnosed due to lack of facilities and lack of awareness. A congenital heart defect is a problem with the structure of the heart. It is present at birth. Congenital heart defects are the most common type of major birth defects. Every one newborn baby out of 100 to 120 babies suffer from congenital heart disease. 50,000 babies die every year in our country before their first birthday due to their untreated heart disease. Of all the deaths due to congenital malformations in children less than 1 year of age, half are due to congenital heart diseases. 25% of congenital heart diseases are undiagnosed even in school-aged children. These facts are alarming. Therefore, there is an extensive drive in developed nations to diagnose congenital heart diseases at birth before children die undiagnosed and untreated. Majority of congenital heart diseases can be successfully diagnosed in pregnancy between 18 to 20 weeks of gestation by ultrasound of heart. This can help parents in crucial decisions.
Congenital heart disease start with the fetal life. So we would like to see the pregnant ladies who have already been diagnosed with a congenital heart disease, or they have a previous child with congenital heart disease, or they have been diagnosed to have a diabetes mellitus, or they are on certain medications like anticonvulsant, antidepressants. The ideal window time for diagnosing a fetal congenital heart disease is during the 18 to 20 weeks of gestation. We can see and diagnose almost all possible congenital heart disease during the fetal life only, and we can give them the guidance about the delivery of the child who may require certain interventions at the neonatal time. Or we can see other children like with irregular heartbeats, or children with a history of poor or no weight gain, children with a recurrent cough and cold or requiring hospitalization for pneumonia, children with congenital malformations, any other syndromic association, or physician anytime auscultate on a children and found to have abnormal heart sound, which can be indicative of a certain congenital heart disease. Or commonly children may have cyanosis like blue lips or blue fingers, or children having hypertension, children with unexplained heart failure or previous heart surgeries, and adults who are known to have a congenital heart disease such as hole in the heart can visit and get benefited with us.
In the current era, majority of children with congenital heart diseases can be successfully treated or operated. Long-term survival rates for children with congenital heart diseases are estimated to be 95% for simple congenital heart disease, 90% for moderate congenital heart disease, and 80% for complex congenital heart disease in current era. In the past, children born with a heart problem usually required open heart surgery. However, transcatheter interventions allow selective patients to avoid cardiac surgery or scar. Surgeries or catheter interventions can be offered at any age and at any weight. One doesn't have to wait for the child to grow if the surgery is indicated. Heart surgeries or catheter interventions should be done in timely fashion as per the advice of physician looking after the baby.
There are two types of congenital heart disease, one with a simple holes which we can close with a simple transcatheter interventions without surgery that won't cause any scar to the patient or a baby. We go through the one leg vein and close the holes, simple holes with a device closures, whether they can be a newborns or any age up to the adulthood. So we guide other problems when children having cyanotic heart problems, we guide them for the surgical treatment also.
A pediatric cardiologist is a physician who has received extensive training in diagnosis and treating children's cardiac problems. Evaluation and treatment may begin with the fetus since heart problem can now be detected before the birth. He or she are also trained to look after adults who were born with heart problems. There is common misconceptions that a pediatric cardiologist can only look after children. In fact, it is easier for a pediatric cardiologist to intervene on adults who are born with a heart disease but never knew about it. These procedures are not only offered to children but also to adults, and in fact easier in adults as they are technically less challenging.
Lastly, in my experience, parents are very anxious to see a cardiologist, thinking that it will only lead to the major operation and huge expenses. On the contrary, majority of the referrals leads to nothing more than reassurance.